Hello, good afternoon, everyone. Good morning if you're in US time zone. Good evening if you're in Asia. Welcome to this webinar of Allurion. My name is Alexandra. I'm the head of marketing. We still have people coming in, so welcome everyone if you're just joining. Apologies, we are a few minutes late, but we're all ready to go. Before we go, just a quick admin update for the people that this meeting will be conducted in English. For people who would rather have translations, you can activate translations in Microsoft Teams. What you do is you go to the three dots at the top of the screen, which says More. You go under Language and Speech. Then you click Show Live Captions. If you are there, if you're under live captions, and you will see captions rolling, there is the little mark you can click on, and then you can select your language. Yes, it should not be in Arabic. So, Louis, maybe you can change it back to English, because then the system will get confused. So the meeting language is in English. Yes. Okay. Great. With everyone. All right, ready to go. So I'm going to hand over to Shantanu Gaur, who is our co-founder and CEO. Next to Shantanu, we will have a couple of other speakers. Bill Nadeau from our medical team will talk on this meeting, as well as two doctors, Dr. John Loy of Ireland and Dr. Adelardo Caballero of Spain, and they will be introduced in more detail by Shantanu, and then of course in their own sections. We've got a full program for you today. It will take about an hour and a half in total, or an hour and 22 minutes from now. At the end, we will have time for questions. There is a Q&A section in the meeting. You can click on that. And if you have any questions at all during the meeting that come up, you can type them there, and we will address the questions at the end of the meeting. Recording will be made available, and we all hope you have a great session today on World Obesity Day, March 4th, with the Allurion team and our doctors. All right, handing it over to Shantanu. Shantanu, please go ahead for your section.
Wonderful. Thank you, Alexandra, and thank you everyone for joining this morning, this afternoon, this evening, no matter where you are in the world. Today's a very special day. It's World Obesity Day, where all of us, patients, providers, members of industry, come together and celebrate all of the great accomplishments and advancements that we have made in obesity care, not just in the past year, but in the past several decades. I'm very honored and privileged to be joined by Dr. John Loy, who is one of our longest standing partners, an exceptional bariatric surgeon and a true leader in obesity care globally. He will be presenting his perspectives and experiences using the Allurion program in the larger context of obesity care. We're also joined by another long-standing partner, a dear friend to Allurion and many of us on this call, Dr. Adelardo Caballero. Dr. Caballero practices in Madrid, and his institute is one of the leaders, not just in Europe, but really globally, in integrating multiple different modalities of care and therapeutics in a single institute, providing patients a very comprehensive obesity care treatment program. So these are two real luminaries and pioneers in the field of obesity, and we're very honored to have them here today presenting their perspectives and views on Allurion in this next generation of obesity care. I'll take control of the presentation. Perfect. And let's get started. I wanted to share just a few slides with all of you about how we are thinking about the future of obesity care, not just here in the United States where I sit, but really globally. And we've established a framework at Allurion that's called metabolically healthy weight loss, where we are focused on three key parameters. The first is losing weight, and that too, losing weight rapidly. That has become an unmet need in the world of GLP-1s, where people do lose weight, but the weight loss often takes quite a bit of time, 52 weeks, 68 weeks. You've all seen the clinical trial data where the curve does take some time to get to really truly meaningful weight loss. And then typically, as is the case with almost any obesity intervention, probably other than bariatric surgery, once the drug is stopped, once the balloon has left the body, the struggle really then becomes keeping the weight off. And so this is the second point that we're laser focused on at Allurion, helping people lose weight rapidly, but then keep it off in the long run. And then the quality of the weight loss really matters as well. We have become very focused on maintaining muscle mass, maintaining lean mass. Again, this is something that the GLP-1s have highlighted as a real issue, where people will take a medication to lose weight, but 40% of the weight that they lose will come from muscle. And that, from a metabolic standpoint, doesn't really lead to long-term improvements in metabolic health. So this is our framework at Allurion, and we share this framework with you for you to use in your own practices, where you're focusing not just on weight loss, but weight maintenance and also maintaining muscle. And we'll come back to this theme as the webinar goes on over the next several slides. The other key trend that we have seen at Allurion over the past 2 years is this concept of GLP-1 discontinuation, where patients start a GLP-1, then they stop, and then they regain weight. And this is creating a huge market opportunity and a huge clinical unmet need, where there are literally tens of millions. Here in the United States, there are already 20 million people who have started a GLP-1 and stopped a GLP-1. And what happens when you stop? You regain weight. That number is going to double over the next 2 years. I don't have the statistics for each and every country that is joining us today, but I can tell you that in my travels to many of you over the past 6 months, I hear this over and over and over again, that patients are starting GLP-1s, stopping, and then regaining weight. Why are they stopping the GLP-1s? Well, there are side effects. They don't like to inject themselves every week or take a pill every day. There's concerns about long-term cost. And then there's concerns around having to be on a medication for the rest of their life. That's not something that a lot of patients accept right out of the gate. There are also patients who just don't lose that much weight with GLP-1s. That's a fraction of patients. It's not a majority by any means, but some patients really struggle to lose weight on GLP-1s. So all of these reasons are contributing to tens of millions, if not hundreds of millions of people starting a GLP-1, stopping, and then they'll come back to you, the doctor, and ask you, what can I do next? And that's a great opportunity for a patient to start Allurion, or if they qualify for it, perhaps even go on to get bariatric surgery. So this is a trend that I would love, if you guys do have your own perspectives on in the Q&A session, I'd love to hear more about what you're seeing in your local countries and territories with regards to this. And that creates a massive opportunity and need for something like the Allurion Smart Capsule. We were very pleased to receive FDA approval just over 10 days ago. It's a big milestone for Allurion, but it's also a big milestone for our partners and patients all over the world, because with that FDA approval, our device certainly increases in credibility, in trust, and it really validates the safety and effectiveness of our product. We've already treated over 200,000 patients around the world, thanks to many of you who are on the call, who have built really impressive practices around Allurion. And I'll walk you through some of our most recent data where we're showing now very clearly that Allurion can work with a GLP-1. We are not working against GLP-1s. We are working with GLP-1s in combination. We've shown time and again that our smart capsule is extremely efficient and convenient for both the patient and the physician and their team, swallowed in a 15-minute office visit, no endoscopy, no anesthesia. And what truly sets us apart still to this day is that after 4 months, the balloon opens and passes on its own. Really revolutionary technology, even to this day. And our safety profile and effectiveness profile continues to improve. Compared to endoscopic devices, we are anywhere from 5 to 10 times safer when it comes to the rate of serious adverse events. Our intolerance rate in our studies that we've published over the past several years has stayed in the range of 2 to 3%. The way the balloon is designed, from very thin film, soft materials that are gentle on the stomach, really lead to a very comfortable experience for patients. And on the next slide, I'll actually walk you through some of the effectiveness data that we have with the Allurion program. The Allurion program repeated with 2 cycles of balloons, which Dr. Caballero has actually published on, and then Allurion plus the GLP-1, and what that leads to in terms of weight loss, but also what we're seeing in terms of muscle mass gain, which is, I think, really groundbreaking in the field of obesity. Many people focus on the smart capsule as the core of our offering, and it is. But for those of you who are using the smart capsule in your practice, I know that many of you value the digital components that we provide with the Allurion program as well. All of our patients use the app, the scale. Coach Iris is now available for the Virtual Care Suite Plus, where patients are able to 24 hours a day, 7 days a week, have someone by their side to help them with their weight loss journey, in addition to the staff and team that you have at your clinics. And I hope that all of you are using Allurion Insights. That is the physician software that we have built and the care team software that we have built to help you manage all of the patients you have at Allurion. And also, it has capabilities to manage your patients who are going through bariatric surgery or GLP-1s or some other type of weight loss intervention. So I encourage all of you on the call, if you haven't used Allurion Insights, or you started and then you stopped, we want you to keep using it because it's really demonstrated to generate better patient outcomes and make your life easier managing all of this data that is produced by our patients using the scale and through all of their wearables. I want to spend a couple minutes on this slide because it summarizes the most recent data that we have at Allurion and also our perspectives on how Allurion is being used in the world of GLP-1s. We see 2 ways that Allurion is being used, and many of you on this webinar have pioneered these approaches. The first is as a standalone therapy, or Allurion by itself, without a GLP-1. And we see this most effective in patients who tried a GLP-1 and it didn't work, or they didn't lose weight, or patients who needed to get to a higher dose of GLP-1 but couldn't quite get there and stopped taking the GLP-1 medication. For those patients, our smart capsule and the program that surrounds it is a perfect option, absolutely perfect option, because they want to lose weight. They tried, it didn't work. Most of them don't want bariatric surgery, and so Allurion is perfectly positioned for those patients. The other way Allurion is being used is in combination with a low dose of GLP-1s. And that combination therapy is becoming quite a popular choice, both for physicians and patients, because at low doses of GLP-1s, the GLP-1 complements the Allurion Smart Capsule. It leads to more weight loss. It leads to better adherence to the GLP-1 because at low doses, the side effects are minimal, the cost remains lower, and it's a much easier experience for the patient. And then with our program, even with a low dose of GLP-1s, patients can gain muscle mass and gain lean mass. And so what you see in this chart is various ways that Allurion is being used right now in the field. Some in the early days, before we had built the virtual care suite, before we had built Coach Iris, and before we had built the behavior change program that we have at Allurion, many of our physicians were placing the smart capsule and providing very light follow-up with a dietitian or a nutritionist. In that scenario, patients would lose 10% of their total body weight. They would maintain some of that weight over time. At 1 year, the data shows that the patients lost around 7% of their total body weight. This was our early data, 2016, 2017, 2018, when we just launched the product, primarily in Europe and the Middle East. And then we built our program. Then we built the virtual care suite, Coach Iris. We started partnering with clinics that provide very close follow-up. Two of them are on this webinar, Dr. Loy and Dr. Caballero. Their clinics provide exceptional follow-up. And with that follow-up plus Allurion, the weight loss increases. The average weight loss at 4 months moves up to 14%, and the weight maintenance also gets better. After the balloon is gone, the patients will maintain almost all of their weight loss with appropriate follow-up. And then we started experimenting with different parts of the protocol. Through the work of Dr. Raftopoulos, who is now in the United States, but used to practice in Greece, he developed an intensive Allurion program where there was more follow-up. There was more prescriptive or detailed advice regarding diet and exercise. And then you see the weight loss go up to 16%, and that weight loss can actually continue at 1 year. More recently, this is data that we just published and presented in 2025. Dr. Caballero and colleagues looked at consecutive use of the Allurion Smart Capsule. And here you see that with 2 cycles of the Allurion Smart Capsule, patients lost 22% of their total body weight after a year of therapy. And when you combine just 1 cycle of Allurion with a low dose of GLP-1s, which is the last 2 bars on this graph, you'll see 23% total body weight loss at 1 year. This data is with low dose tirzepatide in combination with Allurion. So the key message here is Allurion is very versatile. You can use the Allurion program in different ways to fit the needs of your patient. And it's different than any other therapy that's out there because it can really be combined with GLP-1s. It can even be used as a precursor to bariatric surgery, or it can be used as a standalone therapy, really depending on what your patient needs and what your goals are for that patient. We talked a little bit about metabolically healthy weight loss at the beginning of the presentation. In one slide, this is metabolically healthy weight loss. Fast weight loss, the first data comes from Dr. Raftopoulos' study comparing Allurion plus intensive lifestyle change versus intensive lifestyle change alone. You can see the speed of the weight loss with Allurion, 15% in just 4 months. And in the second part of the slide, you see the maintenance. You see what happens after Allurion, the Allurion balloon is gone. Patients can actually maintain 95% of the weight that they lost. It's a truly exceptional result, and it speaks to how much the program and how much your team matters in helping these patients keep the weight off. And I haven't touched on it yet, but we will here. In this third panel of the slide, you see data from Dr. Dejou in Romania, where he actually looked at approximately 450 patients that he had treated with Allurion and tracked not just their weight loss, but also their lean mass. And you can see here, in absolute numbers, the lean mass of these patients actually increased on average, while their overall weight went down over 4 months. Truly remarkable result. You're losing weight, but you're gaining lean mass. What's lean mass? Your muscle, bone, other non-fat mass that's truly vital for your metabolic health. So this is the type of result that your Allurion patients can achieve Again, if they're surrounded by the right program and they're receiving the right follow-up. This is also why Allurion Insights is so important. Allurion Insights helps you track all of this data so that you keep your patients on track, not just from a weight loss standpoint, but also from a muscle mass standpoint. And finally, this is some data regarding our combination therapy that we have collected and presented last year. This is work done by Dr. Flagello in Naples, Italy, a real pioneer in this combination therapy approach. He's treated now over 150 patients in combination with low doses of both semaglutide and tirzepatide. This first chart shows you what happens when you combine Allurion with semaglutide. The weight goes from 120.6 kilos down to 96 kilos, 20% total body weight loss. And the lean mass as a percentage of total body weight goes up from 60% to 68%. So low dose GLP-1 plus Allurion, better weight loss, but still you get some improvement in lean mass. And similarly with tirzepatide, when you combine the two, Allurion plus low dose of tirzepatide, you get to 23% total body weight loss and an increase in lean mass from 62% to 70%. And what you'll notice is that this data for semaglutide is for 8 months. The data from tirzepatide is for 12 months. These patients are staying on their drugs for the whole duration of the study. And so that I think speaks to the power of low doses of these drugs being used in combination with Allurion. If the patient wants that additional weight loss without losing muscle mass or lean mass. So there's a huge opportunity now that has been created by GLP-1s. I know that many of you have seen your practices get impacted negatively by GLP-1s over the last 2 years. But I've spoken with many of you, and those of you who have embraced this way of working where you're using different therapies, you're providing comprehensive obesity care to your patients, many of you have seen your practices return to the volumes that you once had. And I'm a big believer that this year and next year, you're going to start to see more and more patients come to you after having tried a GLP-1 not working or regaining weight after they've stopped, and they're going to be looking to you for an answer, and hopefully Allurion is part of that answer. So this is my final slide. It's a quote from Abraham Lincoln, my favorite US president. The best way to predict the future is to go out and create it. And I think we all have an opportunity to create the future of obesity care through a commitment to comprehensive care of our patients, which includes Allurion, includes bariatric surgery, includes medications, and includes any new innovative therapies that are developed between now and then. But we are here to tell you that we believe that Allurion is going to be a major part of the future of obesity care. And thanks to all of your hard work and commitment, I think that vision is going to become a reality. So I will stop there. I'll remind you to please ask any questions in the Q&A. We will address that at the end of the presentation. And now I believe I will turn it over to Bill Nadeau. Bill, over to you.
Shantanu, thank you. Good day, everyone. My name is Bill Nadeau. I lead medical affairs at Allurion with a particular focus on education, clinical evidence, and patient safety. As is clear from Shantanu's presentation, we are rooted in science. And so I am here to briefly share with you the scientific evidence behind metabolically healthy weight loss. First, we'll focus on the first pillar, which is losing weight. And I'm honored to share the data from Dr. Yannis Raftopoulos, looking at the combination of the Allurion Smart Capsule with the intensive lifestyle intervention program that his team offers, both in the short term as well as in the long term. This was originally presented at ASMBS in 2021, and then more recently accepted as a full journal publication in obesity surgery just a few months ago. Dr. Raftopoulos' study looked at two different groups of patients, one, again, who received an intensive lifestyle intervention program, and then another which received that program in combination with the Allurion balloon. If we look at the data, first at 4 months or 16 weeks at the time of balloon passage, in red font, you can see that those patients who received the combination treatment achieved almost 15% weight loss in just 16 weeks. And those patients who were followed out to 1 year, as Shantanu mentioned earlier, continued to lose weight thanks to his robust program. And so you can see here that after just 16 weeks, the combination approach leads to nearly 2.5 times the weight loss that's achievable with an intensive lifestyle intervention alone. And if you look at it at the bottom as a responder analysis perspective, you can see that those patients who lost at least 10% of their weight were those who were mostly in the combination treatment. In fact, 10 times more patients achieved that threshold of 10% weight loss with the combination treatment. The next study that I'd like to highlight is how to keep the weight off. Dr. Caballero, who will be speaking to the group in a bit, shared or published this evidence, again, just previous year in 2024, in obesity surgery, and I'm honored to present his research looking at weight loss maintenance 1 year after the swallowable gastric balloon results from an international multi-center study. Dr. Caballero and colleagues looked at data from 9 different international obesity centers. He followed his patients for 1 year after the balloon passed. His patients were monitored through the Allurion Virtual Care Suite and so had access to the scale, the app, as well as Allurion Insights. And this study enrolled 522 patients. As you can see here, patients did quite well, as Shantanu shared earlier. They lost almost 14% of their weight after just 4 months. And 1 year later, at month 16, 95% of the weight that was lost during balloon residence remained off. Patients also did quite well from a metabolic parameters perspective, showing improvements in 4 months with triglycerides, LDL, and hemoglobin A1C. And adverse events are listed here in the slide. And so the conclusion, of course, is that the program demonstrates excellent short and long-term efficacy for weight loss and shows nice improvements in metabolic parameters with a strong safety profile. The last and third study that I'll present here are the results from Dr. Deju in Romania, looking at weight loss efficacy using the Scale app and health tracker with a particular focus on muscle mass. This study was a single center study in Romania that enrolled 571 patients. What's important to note here is not only that patients did quite well from a weight loss perspective, but they also demonstrated, as Shantanu mentioned earlier, improvements in both lean mass as well as body fat. In fact, these patients gained lean mass and lost body fat in just 4 months. Also important to note that the safety profile in this large study demonstrated that there were no serious adverse events. And so I'm honored to share these data, as Allurion is in fact rooted in science. When we describe metabolically healthy weight loss, that evidence base for losing weight, keeping it off, and maintaining muscle is very strong. I'll turn it back over to Shantanu.
Thank you so much, Bill, and thank you for presenting that data. For those of you who are have any questions on that data or any additional questions, feel free to, on the Q&A tab at the top of your screen, drop in a question and we'll make sure it's answered. So without further ado, I'll turn it over to Dr. John Loy. As I mentioned, Dr. Loy is a longstanding partner of Allurion and a real friend to many of us, and mentor and advisor, someone who has done it all in the world of obesity care. And his credentials are too long to go through right now because we want to get you all out on time. But let me say this: he's truly an expert in obesity care and has created an exceptional practice at Auralia Clinic. And I'm really honored to have him here today talking about how he is using Allurion in his own patient care algorithms at Auralia. John, I'll turn it over to you, my friend.
Thank you very much, Shantanu, for those very generous, probably too generous words. And thank you, Alexandra, and everyone for organizing this fabulous meeting today. John Loy is my name. I'm a consultant bariatric surgeon here at Auralia Clinic in Dublin, Ireland. I trained in Belfast and then took myself off around the world via England, New York, back to England, and now back to Ireland. So I've a fair bit of experience from my travels and my work, both in the UK and in New York, and back now home in Dublin. So I'm a full-time bariatric surgeon, and I offer the full range of bariatric surgeries. And I also previously offered the implantable endoscopic gastric balloons as part of a full arboretum of bariatric procedures to patients. And long before the Allurion came to the UK market, I was happily implanting the endoscopic balloons, and essentially around about 2017, 2018, I was introduced to the Allurion capsule balloon, and I took it on somewhat skeptically, but I was amazed immediately by the dramatic decrease in patients calling up and reporting side effects. Now, I would implant these endoscopic balloons on a Monday, and I would come in on a Tuesday and a Wednesday, and there'd be lots of phone calls for me. Patients were unhappy, they were being sick, they were vomiting, and my early explant rate was reaching about 20% with the endoscopically placed balloons. And as a surgeon who's busy full-time doing other things, covering on calls, covering general surgery, the last thing I want to be doing is going back to an unhappy patient and having to take out something that they've spent a lot of money on, that's left them unhappy and hasn't given them a great result. That all changed dramatically when I introduced the Allurion Smart Capsule into my practice. And I sort of had to ask my secretaries, were the telephones working or had they been broken? Because I was coming in the morning after placing Allurion, and there were no calls to answer.
Dammi il lancio di mia.
There were no calls to answer. And so it really gave me great encouragement. And I thought to myself, well, if this smart capsule can match the results of the other balloons, then why should I continue to use the other balloons? And I switched my practice entirely from the endoscopic balloons to the Allurion balloon. Now, what benefits has that brought? Well, the patients firstly love it because they're not having sedation. There's no painful needles going into their arms. They don't have that groggy side effect of having intravenous midazolam in their system for 24, 48 hours, and they can go back home the same day. In fact, they can take themselves up to your clinic or your facility and take themselves home. So they're not relying on other people to drive them to your clinic and drive them home again. I always, of course, tell them to have a very easy night and probably take the next day off work anyway, and then allow the balloon to settle into the stomach over the coming few days. Another little trick and a tip is a useful tablet called Akinzio, and it's quite a strong antiemetic that I give them 2 hours prior to procedure, so that it really does decrease any potential sickness or vomiting after the capsule is inserted. So with that, I looked at my weight loss, I looked at my patient satisfaction, and all those parameters were greatly increased when I swapped my practice to the Allurion. And people started saying, well, actually, why would I bother coming to have a hard silicone balloon implanted in my stomach that's going to make me really sick? really, give me a terrible few days when I can have something that's much more malleable, much easier on the stomach, and will in fact give me the same weight loss. So in terms of people thinking about this for their practice and introducing it to their practice, perhaps where they already do something else, I would encourage them to seriously consider it. There's much less cost, there's much less manpower, there's much less resource needed in terms of equipment and drugs and recovery wards and space. And all of those things in this day and age are very, very important, both from a commercial point and from a patient satisfaction point. People don't want to spend hours in hospital. They don't want to spend a day in hospital. They don't want to potentially have to come back for a removal and another 24 hours of feeling groggy. So those are important considerations I would encourage you all to look at when you're thinking about setting up Allurion in your own practice. Of course, safety is important and paramount, and I have had no serious adverse events with my over 1,000 Allurion implanted. My early takeout rate is similar to the published data on Allurion. It's about 5-6 times less than previous balloons. And so in terms of scalability, for example, tomorrow I'm doing 3 sleeve gastrectomies in the morning, and then in the afternoon I simply go across to the other side of the clinic and I'll implant 8 Allurion in the afternoon. And from again a commercial point of view, we'll do much better from the Allurion than we will with the sleeve. I'll go home, I'll not be worried about them, and the sleeve patients will still, of course, be in overnight, and I have to go in and see them the next day, etc. Now, patient choice is appropriate, is important. We need to look at effectiveness also as doctors and clinicians. We need to look at outcomes. And Shantanu and Bill have both presented very succinctly there the published data that are available on the Allurion capsule to date. I think personally that the future, of course, is combination therapies. I think for us as bariatric surgeons and physicians treating the chronic disease of obesity, a combination and picking the right procedure for the right patient at the right time in their life is key to success. And of course, if someone comes to you in their journey and they don't want to have surgery and they're dead against it and they don't want to inject drugs into their body, then there is a unique place for that patient who qualifies to have an Allurion gastric pill balloon. Those patients can, of course, proceed then 3 or 4 years later to surgery. You might have advised them in the first place, perhaps the balloon mightn't just be for you. If you're very high BMI, you're diabetic, you have other comorbidities, then of course surgery is a very powerful tool for those patients and could be the right choice. But because you offer the Allurion in your clinic, that acts as a door opener. That brings the patient across your threshold, brings them into your clinical arena, and brings them into your ecosystem so that they are there. They may or may not have the Allurion. That's okay. They may instead opt for surgery. But the reason they've come to you is because you can offer them the choice. You can offer them clinically proven, effective tools to help with their weight loss. Now, if we look at the benefits, I've talked already about increasing your clinic capacity, and we know as bariatric surgeons that we have suffered declines in numbers, particularly in the UK in private bariatric surgery, according to the NBSR registry over the last year since the introduction of GLP-1s. And I think that GLP-1s are fabulous. I think they are definitely a great treatment for those who are eligible. However, some people do have side effects. There are availability issues, affordability issues, and effectiveness issues for some patients who are experiencing the side effects. And so by opening your door to the GLP-1s, to the Allurion, to the surgical options, you're now able to offer your patients a wider choice of procedures, and you're able to bring more people into the clinic who might not have otherwise come. I will continue on by talking about the impact on surgical volume. I was once told about 10 years ago by a professor of surgery that I was 1 molecule away from unemployment, and that was when the GLP-1s were in development. And I have to say in the last year, with the increase in GLP-1s, my surgical volume has almost doubled. And the reason is that it's opening people's eyes to available treatments. The Allurion is opening people's eyes to available treatments, and surgery is now becoming also more acceptable. And I know the team at Allurion have no problem with people going for surgery. And in fact, we have offered, a lot of Allurion patients surgery instead. And that's okay, because patients will actually improve their, will actually rate you higher in credibility if you give them a really honest appraisal of what everything is and what everything can do for them. So, as I said, we now, because we've introduced Allurion, have a higher clinical throughput. We have more patients coming and inquiring. We have improved and increased our number of Allurion, and with that, the number of happily treated patients. These developments are all supported, of course, by the fabulously brilliant Audacity clinical trial in the United States. The FDA regulatory approval also adds clinical kudos to the Allurion gastric balloon. And I think anyone who's considering introducing this into their clinical practice will be rewarded with happier patients, with an increase in clinic patient volume, and with a higher profile clinic going forward. And so with that, I'll hand back to Bill, and thank you very much for listening.
Thank you, Dr. Loy. Fabulous insights. Really insightful, inspiring to hear your words. So thank you for sharing them.
You're welcome.
John, every time I hear you speak, it always gets me inspired about the future, because I think what you're doing in your own clinic is really admirable, because so many bariatric surgeons, I think, have retreated. Like your mentor once said, they actually believed that they were one molecule away from unemployment. And I think your experience has demonstrated just the opposite. That
we really have to keep the faith in this, because we were operating in the UK and Ireland on 0.25% of eligible patients, and the incidence and the prevalence of obesity is going only one way at the moment in the world. And we must be there, and we must be continuing to offer all of those treatments. And there has been a temporary blip, but I do think and agree with you, Shantanu, that there will be a very quick return to normality, and both the Allurion and both the GLP-1s have a vital role to play in this.
Absolutely. And I think we'll hear potentially something similar from our next speaker, Dr. Caballero. Dr. Caballero, as I mentioned, practices in Madrid, Spain, at Instituto de Obesidad. His practice, if you haven't had the fortune that I have, good fortune to visit, is again an example of truly comprehensive obesity care with exceptional follow-up and exceptional results. Dr. Caballero has also published widely on not just his experience with the Allurion program, but his experience with various bariatric surgical interventions, and also the use of GLP-1s. So Adelardo, it's a real honor and privilege to have you here, and I'll give you the floor and turn it over to you, my friend.
Thank you, Shantanu.
It's actually,
Dr. Caballero,
yes.
If I may, there was just a few slides I'd love to share to further introduce you and the evidence that you're going to speak about. So if it's okay with you, Dr. Caballero, I'll just share a few more slides, and then I'll be honored to turn the floor back over to you. So excuse me for interrupting.
I screwed that up. Sorry, I screwed that up. It's over to Bill first. Sorry, Adelardo. We'll be with you in a couple of slides.
I'm very honored to continue presenting just 3 more studies. And now we've shifted gears from looking at Allurion as a standalone therapy, which is clearly very safe and efficacious long-term, for the use of now Allurion in combination with GLP-1s. And the first study I'm honored to share with you is a study conducted by Dr. Flagiello in Naples that was presented as an oral presentation at IFSO just last year in Santiago. The title of his study is Metabolically Healthy Weight Loss, Synergistic Effects of the Swallowable Balloon and Low-Dose GLP-1 Therapy on both muscle mass and GLP-1 adherence. Dr. Flagiello conducted the study in 52 patients. He started all patients, of course, with the Allurion balloon. After 1 month of balloon residence, he introduced a very low dose, 0.25 milligrams of semaglutide. After 1 month on that dose, he increased it for his patients to 0.5. And at the end of balloon residence at month 4, he increased it further to a maximum of 1.0 milligrams of semaglutide. And this study was carried out for a full duration of 8 months. After 8 months, patients did incredibly well. Patients lost over 20% of their weight in 8 months with that combination approach of Allurion plus low-dose GLP-1s. In addition, they increased their lean body mass and decreased their fat mass. Safety was strong, and importantly, as Shantanu had mentioned earlier in the presentation, the use of a low dose of the GLP-1 enabled 100% adherence to the therapy for the entire duration of the 8-month study in all patients. The second study that I'm honored to present is research conducted by Dr. Roberta Ienca out of Rome, looking at the combination of Allurion and full dose of semaglutide. This research was presented at the ECO Congress last year in Malaga. Her study was a 10-month study conducted in 3 countries where she used the Allurion Smart Capsule and then after balloon passage added semaglutide for an additional 6 months, starting at the low dose of 0.25, but increasing it to the full dose of 2.4 milligrams. And her follow-up for her patients, as well as those in Spain and Argentina, is robust. She does require monthly in-person follow-up for all of her patients for the duration. Patients did, not surprisingly, very well. After 4 months of just balloon, patients achieved almost 16% weight loss. And then after semaglutide was added, at the end of the study, patients achieved over 21% weight loss. And so very robust weight loss when combining or using consecutively Allurion and then semaglutide. And you can see additional improvements in waist circumference and other metabolic parameters. And finally, the third study that I'd like to share with you is an interesting one looking at non-responders or patients who did not achieve at least 5% weight loss with GLP-1 therapy, and how did they do with the Allurion Smart Capsule. This research was presented at Obesity Week in 2025. This study included patients from 2 clinics. It was a smaller study with 27 patients from Colombia and Argentina. All patients were treated first with liraglutide, because it is a bit of an older study, for 3 to 6 months, and either achieved no weight loss, which occurred in 55% of patients, or less than 5%, which was achieved in the remaining 45% of patients. The GLP-1 was discontinued at least 12 months prior to the Smart Capsule placement. And you can see here in the 27 patients at 4 months after balloon treatment, or excuse me, at the end of the 4-month treatment, patients did very, very well, achieving 17.6% weight loss in just 4 months. And from a responder perspective, you can see that all of them achieved at least 5%, with many achieving up to 20 and more than 20%. And so the conclusion here is that the Allurion Smart Capsule can be an effective option for those patients who either don't respond to or don't tolerate GLP-1 medications. And so now it is my honor to hand the microphone and the control to Dr. Caballero. Please, Dr. Caballero, go ahead.
Well, thank you very much, Vale. Thank you to Shantanu, Alexander, and all our colleagues here attending the meeting. I'm going to be presenting our experience with the Allurion small capsule. And I want to introduce myself. My name is Adelardo Caballero. I work in Madrid. I'm a bariatric surgeon, but I also the medical director of the Instituto de Obesidad, where we do all sorts of treatments from overweight till very complex revisions. And this is what I just mentioned before, that we've been working along with Allurion for many, many years. And we've published several articles in the treatment of different balloons, especially with Allurion, and seeing what the effects on adolescents, also long-term results, and different papers that have been published or presented at the IFLO. This is, I want to show you how we choose the patients for Allurion capsule therapy. If you consider the BMI classification, you can order from overweight till super obesity, and we think the balloon is indicated in this area here. So patients with obesity 1, obesity 2, or overweight. And then I've differentiated here the new the new medications, the Allurion alone, and the Allurion and GLP-1 drugs. Also, there is a very important area for surgeons, which is patients with super obesity or very high obesity index, and we usually we're invited to do that with GLP-1 for the preparation of those patients. But unfortunately, if we do that, you have to stop 3 weeks in advance surgery, because the patients will have dilated stomach, and then they will have extremely risk for aspiration in the induction of anesthesia for surgery. So except for that case, we're concentrating this area and before, or in the between area of overweight and obesity 1 or 2. And see the new medications are GLP-1 to understand that is a hormone that we all have in our body, and when we eat something that hormone will increase and affect all the organs that are here. With the new medications, we can use this subcutaneously, and basically we are going to be effects on the central nervous system, on the in the bowel, in the stomach, in the pancreas, but also for tirzepatide, we can also have effects directly on fat. And the two major problems with new drugs is basically that we can anticipate a rebound practically in 80% of patients. So, and to avoid that, there have been some different approaches, like physical exercise, force exercise, the use of creatine, radio frequency, and what is now coming is the maintenance of GLP-1s orally for a long period of time. So trying to avoid this rebound, which is practically consistent. Okay. The other problem with the new drugs is the loss of lean mass or muscular mass. If you see here, when the patients lose weight, they lose fat and muscle. And next time the patient is going to lose, it's going to have a rebound. This rebound is basically fat. But if this patient goes on a GLP-1 treatment again, then you will have also the loss of fat, but also lean mass, muscular mass, and so forth. So at the end, we're going to be having a patient with practically the same amount of fat, but very, 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 very low levels of lean mass. The other problem that we have is malnutrition. Malnutrition is also happening with LGP-1s because some patients take it. This is like a simple diet. They don't do diet, so they don't take any vitamins, so they don't take any advice. So this is what we are seeing very often: patients that don't have the supplements that they need. Okay, and I want to show you this slide. This slide can show you the loss of lean mass and fat mass when you use semaglutide. Okay, you can see here the lean mass you can lose up to 30%, and then fat mass is the rest. So if you lose 10 kilograms, probably 3 kilograms are going to be lean mass. But to avoid that, as I told you, there are several physical things that we can do, but there are also medications. In this case, we use with showing here the use of monoclonal antibodies developed by Regeneron. And when we use semaglutide plus this and plus this and the triple treatment, then you can reduce the percentage of lean mass by whatever, something we don't know. So we can decrease down to 7.4% in the triple. In the case that we're using all the semaglutide and the 2 monoclonal antibodies. But in this group, we have to remark, obviously they have a muscle hypertrophy, but because they're not losing 33% of mass. But in this group, there have been 2 deaths, 2 cardiac deaths, probably because, very sick people in these groups, we don't know yet, but we cannot forget about cardiac hypertrophy that might be the cause of those deaths. So still, there is a question if when you lose lean mass or muscular mass, you lose only skeletal muscle, or you are not losing cardiac muscle as well. So there are some contraindications for GLP-1s that we generally use in our practice, probably all over the world. Patients with thyroid diseases, patients with biliary and pancreatic diseases, adolescents, we don't use in adolescents, patients that are going on a treatment of losing weight for infertility. Those patients cannot be treated with GLP-1s because probably they're going to get pregnant during treatment. And also, as I mentioned before, we don't recommend to use GLP-1s for preparation in bariatric surgery for the risk of aspiration. And to avoid all this and to get the best of 2 worlds, we've been proposing using an Allurion plus GLP-1. And we have 2 different scenarios that we're considering. And we have some experience here. And if you use, during the first month, there's no need for GLP-1s. But after the first month, you can use GLP-1s for a long time. We're going to get very good results, but probably you don't need to do both at the same time. The second scenario is that you're going to be using GLP-1s at the very end of the Allurion balloon period. Probably this is a very good idea, but in our cases, in our experience, patients complain of, abdominal symptoms, sometimes nausea, vomiting, which we don't know is due to the medication or to the balloon that is got infected or whatever. So actually what we are doing is we're using a balloon for 4 months, 16 weeks, and then after the balloon, we've confirmed by echography that is being expeded, then we use the LP1 on very, very low doses, just to avoid muscle mass decrease, okay? So our preliminary results are here. We're doing a multi-centric, multi-hospital, multi-institutions approach, a study to see the real results of what we hypothesize here. When you do a diet, on a diet, you're going to have a rebound. It's here, plus around plus 2 or 3, plus 4 or 5%. When you use the Allurion balloon, the Allurion intelligent capsule, then you're going to get a very good result, better than we use the GLP-1s, because the GLP-1s does rebound for sure, okay? But if we use the best of two worlds, like you see here in this green line, we're going to get a better results using those two. And this is what we want to confirm with our new data in a multicentric and multi-hospital study. So up to now, we can say that the combination of Allurion plus GLP-1 is very effective, is very safe, and is probably very affordable. So thank you very much for your attendance to this talk.
Thank you so much, Dr. Caballero. Really fascinating data. And I think you covered a lot of some of the questions that people have been posing about when to start GLP-1s in combination with Allurion, what types of results we can expect. And I do think that what you are pioneering at your clinic is a very interesting protocol for how to deliver GLP-1s with Allurion at scale. Alexandra and Bill, what's next on the agenda? Should we go into the Q&A at this point? Are there other slides that we need to present?
The slides are done, Shantanu.
Great.
So indeed, it's the Q&A. Yes.
Perfect. Wonderful. Well, before we start the Q&A, first I want to thank all of the speakers today. They've covered a lot of ground. Really, what we covered in the past hour has taken years of development and research in order to put together in a bite-sized format for all of you. And in the main topics that we covered today, the use of Allurion as a standalone therapy or a combination therapy, the exact protocols to be used when you're using Allurion plus a low dose of GLP-1, what are the differences between Allurion and endoscopic balloons, and John touched on this in his presentation, how some of those advantages can actually lead to a much better clinical experience, both for the patient and the physician. And then this concept of metabolically healthy weight loss. You heard a lot from Dr. Caballero's presentation on how important muscle mass is for patients, not just from an aesthetic standpoint, but from a metabolic standpoint as well. And I loved that graph showing the erosion over time of muscle mass as people cycle on and off of GLP-1s. That's the type of outcome we want to avoid, and we can at Allurion with the right type of program surrounding the technology. So let's go into some of the questions from some of the audience members. Looks like we've published a few. Here we go. Let's see. The first question is about weight maintenance and whether or not this is what we see in the publication is actually happening in real life. And John Loy, if you're still with us, I think you are. Yes, you are there. One of the things that I've seen in terms of weight maintenance is after 4 months, the balloon is gone, right? And so it's what you've done in that 4-month period with the patient to help them change their lifestyle. And it's what is happening after the balloon has gone out of the body in terms of the relationship between that patient and your practice to help them keep the weight off. But what tips or pearls do you have for clinics that aren't seeing good weight maintenance after the balloon is done?
So I think firstly, you must manage the expectations of the patient. And one of the ways I describe the Allurion to them is almost like a Control-Alt-Delete. It's like a reset button for the metabolism and a reset button for the body. And it's a very useful tool if it's expected to manage your obesity and your weight in that way. It's important to get in early with good dietetic and good coaching supports. And at our clinic at Auralia in Dublin, we offer the patients a 1-year program where they have access to dietitians online in the evenings when they can do it virtually, just like this. And they all have busy lifestyles. They all have kids to pick up from school, etc. And so when everything's quiet in the house at the evening, that's an appropriate time for the patient to have their one-on-one with the dietitian, with their nutritionist, with their online coach, and access to the exercise classes and all of that. I tell them it's especially important to kick in with that once the 4 months is up and once the balloon has passed. Because, if you do something for 3 months, or some people even say 30 days, it becomes a habit. And it's about developing habits, developing good, healthy habits as well, and maintaining those. So the balloon is your friend, and they're your friend for the 4 months that it's there. And then when the balloon leaves you, you must also then rely on the extra coaching and the extra nutritional support, etc., to maintain those benefits. And of course, I have many patients come back to me who want a second balloon, and we must leave it at least 8 weeks for that second balloon to be placed. And that can be a safety net for the patient. In my experience, they don't get as much weight loss with the second balloon as the first balloon, but that's okay. They know that, they're expecting that, they might get a little bit more, but I really want them to know that that could be a safety net for them if they don't feel strong enough with the coaching alone. And every clinic will be individual in how they price that, how they structure that, and how they offer that to their patient.
Wonderful, wonderful. That answered a couple of different questions that were in the chat. So thank you, John. And Adelardo, John touched on one concept, which is this time in between the two balloons. And rightfully, John says we need a minimum of 8 weeks in between the two balloons. What has been your experience with that gap between the two balloons? 8 weeks, 3 months, 6 months. What have you seen in your patients as you've treated more and more of them with 2 sequential Allurion balloons? Adelardo, are you there? Yeah, you're there.
Yes.
There you are. Go ahead.
Yes, we use the combined balloons, the sequential balloons very often. And at the beginning, we started about a month or 6 weeks after the first balloon. We implanted the second balloon, but the results weren't that good. So we decided to go further, 9 weeks, 12 weeks. So same thing, same problem. So we are thinking now, we've been doing some cases now, we think we have to do the placement, the new placement, before the 3rd week after the balloon is being excreted. So probably we're going to get less symptoms, and we're going to get the as good results. We have to solve that. We haven't data enough. But I can tell you in the last few months, we've been doing that, and we have good results with shorter period of time in between the two balloons.
Interesting. So something for us to explore. You know, in the past, what we have seen is that the shorter the period in between two balloons, especially in the extreme case where you put the second balloon in right as the first one is coming out, you often get very few symptoms, but very little weight loss. If you wait several months in between balloons, you can get more symptoms, but also more weight loss. And you know, now it seems like we might be honing in on maybe a shorter duration in between balloons, but still some sort of break. So for the audience, seems like a topic that we are actively looking at, and I look forward to seeing some of that data, Dr. Caballero, because that could change how we recommend what the minimum holiday is in between two balloons. Very interesting. And then Adelardo, we'll stay with you. There are some questions on when to start a GLP-1 when a patient is on Allurion. It sounds like you've looked at different approaches. The first scenario where you start the GLP-1 in month 1, the second scenario when you start in month 3, and then the third scenario when you start at the very end of the balloon is gone, and then you start the GLP-1. Which one are you using most in your practice now, and which one do you like the most?
I think probably the third scenario is about the best scenario. So you have time for the balloon to work, to develop, to give the long-term activity for long-term maintenance of weight. And you start right away with medication. Medication we're not pretending prolong the maintenance of weight. We want to have lose more weight. So basically, I think the third scenario is the best, and then you can differentiate what is due to the balloon or what is due to medication. It's easier to see what it is, the problem.
Yep.
Or for discomfort of patient.
Makes sense. And John, you know, one of the things that I've seen and some people are asking about is managing symptoms with the Allurion balloon or any balloon in the first week, and then managing them if the patient happens to also be taking a GLP-1, which could lead to, you know, more delayed gastric emptying. Someone asked about, is there an increased incidence of GERD or other side effects when you combine these two therapies? Can you talk to us a little bit, John, about how you manage symptoms, what medications you use, and then how you manage that patient who is having combination therapy?
Again, it all starts in the pre-implant period. So, you know, your patient must read up on it. They must realize that there will perhaps be some reflux. There will be cramping, nausea, discomfort, of course, for the first couple of days. And forewarned is forearmed. And they'll go into the procedure knowing that they have a quiet couple of days ahead at home, no social events planned, and a clear diary. Pharmacotherapy involves PPI medication started a week before the balloon is implanted. So we would typically, any PPI is fine, lansoprazole, omeprazole, esomeprazole, take your choice. The patient must fast for, you know, I give them 48 hours of no solid food before the balloon, and then from midnight beforehand, they don't have any food or liquids until placement. And then afterwards they have PPI whilst the balloon is in place. For some people, just a maintenance dose of omeprazole or lansoprazole is fine. But this morning, for example, I had a lady who had her balloon placed a couple of weeks ago. It was actually her second one, and she's having worsening GERD. And for that, we've doubled up for the next week on the omeprazole. So she's having 40 milligrams BD for the next week and taking her fluids, but taking her diet back a step. So again, I think the important thing here is that the patient has access back to the physician. That gives them and peace of mind. And peace of mind is worth a heck of a lot. It's worth as much as any tablet. If they can speak to you, if you can, have a good communication with them, you're not just putting this in and leaving them to roam free range. You're actually there to support them through the journey.
Fantastic. That for those of you who are just starting up with the Allurion program, what John just said is spot on. It's the communication that you provide to the patients, the watch outs, the cautions that you provide to the patient before they start. It increases their confidence. It doesn't decrease their confidence. It increases their confidence because they feel as if they have a physician and a team that really knows what they are doing and is going to prepare them for every step of the way. And that confidence goes such a long way in decreasing your intolerance rates, increasing your patient satisfaction. And indeed, if you do those two things, you're going to increase your weight loss outcomes and adherence to whatever program you've built at the practice. We had one question regarding the muscle mass increases and lean mass increases that we're seeing. One of the reasons that we believe that that's happening with Allurion on its own and then Allurion plus low doses of GLP-1s is when patients are taking high doses of GLP-1s, they really suppress the drive to eat. And it comes down to the point where because of the high dose of GLP-1s, these patients are eating very little. They're not following a balanced diet, and they're not really exercising or doing any weight-bearing exercise because they're just injecting themselves once a week or taking a pill every day. And they will lose weight. They absolutely will lose weight. But if you're not feeling hungry and you're not following a balanced diet and you're not really doing much exercise, you're going to lose muscle mass. And the special thing about Allurion is, one, with the balloon inside of you, our patients still feel hungry. It's just they can't eat as much when they feel that hunger. So they're able to at least eat, follow a balanced diet, and get some nutrition into them, albeit less than what they are used to maintain their basal metabolic rates. Couple that with the program, and this is where John's team and Adelardo's team comes in. The balloon is not delivered in isolation. It's delivered as part of a program. That program that focuses on high protein diet, weight-bearing exercise, the relationship that the patient builds with your nutritionist, with your dietitian, that is what drives the increase in muscle mass. It's not really the balloon. The balloon is doing what it needs to do in order to help the patient lose weight. And it's not negatively impacting muscle mass, but it's not actively promoting muscle generation. What's doing that is the program that's surrounding the balloon. And so at Allurion, yes, if we were to start selling our balloon without any program and giving it to anyone who just places the balloon and then tells the patient goodbye without any follow-up, we would sell more balloons, but our outcomes wouldn't be the outcomes that you just saw. That's why the team is so important. And that's why we partner with teams like Auralia and teams like Instituto de Obesidad, because they have the comprehensive team behind them to manage these patients effectively. I don't see any other questions in the Q&A. So maybe John and Adelardo, just some final words for our guests. Any final words of wisdom before we wrap up? John, why don't you go first?
I'm a skeptical old surgeon. I'm hard to convince about anything. I take a lot of convincing to introduce new techniques and practices into my own clinical practice. And if something comes along and it's going to make my life easier, it's going to make my patients' lives easier and better, then I'm all in, if it's backed by clinically appropriate evidence. And with the Allurion Smart Capsule, not only have I seen an increase in my practice numbers, I've seen an increase in patient satisfaction, I've seen an increase in our surgical numbers and our volume as well. So for anyone who is even thinking about introducing it, I'm always available. You can connect with me via LinkedIn or through the Allurion team, and I'm very happy to answer any more questions. But no, delighted with it, and congratulations, Shantanu, on a fantastic invention in the gastric pill balloon.
Thank you, John. Thank you very much. Adelardo, any final words of wisdom for our audience?
Well, just want to thank you, all the organizers of this fantastic meeting. And I just want to mention that I believe that I'm a surgeon, but I think there are a combination of different treatments for obese patients in one time or the other time, and we can share. We can have different options, and I think the balloon is a very simple issue, a simple technique, but the results are very good. That it convince anyone for ordinary overweight or obesity, or even for preparation of super obese patients. And the combination of Allurion with the GLP-1s is going to give you a fourth instrument for treatment. And don't be confined that the two treatments can be combined together without any problems, and your results will be much, much, much better.
Wonderful. Wonderful. Thank you. Those are great words of wisdom. Thank you both for joining us this morning. Thanks to all of you out there around the world for joining this webinar, and to Bill, Luis, and Alexandra, and the entire team that put this webinar together. I want to thank you for all of the great content. Some of you have asked, will we share this data and share these slides? I believe we will, Alexandra, to the audience. Is that the plan?
Yes, there will be a recording, and there will be a share out of the key points and the key elements out of this presentation. Yeah.
Wonderful, wonderful. Well, thank you all for joining. Have a great rest of your day. I really appreciate your partnership with Allurion. And once again, Adelardo and John, thank you so much. It was an honor and privilege to have you here today. Signing off, everyone. Take care. Have a great day.
Take care. Bye-bye.
Bye-bye. Thanks, everyone. Bye-bye.